And action. Pam had a question about muscle versus joint pain. And I thought it was a great question because she was actually asking about tart cherry juice. And I think it's a good anti-inflammatory, but only for joints. And I'll get to that in a second. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I put new videos out. Because I do these a couple times a week. If I have clinic hours and I have a great question that's repetitive, like during flu season, or a really good question that I say, hey, that'd be a good video, that I might want to explain more information to later on, if I don't have time in my 20-minute office visit, then I'll put it online. So check them out. And by all means, put comments down below if you want to hear anything. So, how do we take care of distinguishing which herb to use? Well, first of all, you have to know between when you have pain, acute pain or chronic pain, doesn't matter. You have to know where the pain is. If you know the anatomy or the area, then you'll be able to figure out is it muscle or joint. So let's just, this is, by the way, a TENS unit. I'm sorry, not a TENS unit, a Theracane. A Theracane is used with this knob to break muscle spasms. So I'm a fibromyalgia sufferer. My trigger point is usually right here. When I sit and do my typing in the rooms, when I sit into room 2, I look this way. When I sit in room 1, I look this way. In room 1, I'm okay. If I'm all day in room 2, my trigger point for fibro, in fact, it's flaring up now. Trigger point for fibro turns on, so what do? Because fibro is a trigger point in a deep muscle, my trapezius muscle, I will take this knob, I'll wail on this knob to overwhelm the muscle that's trying to spasm up and get it to relax. Kind of like what a massage therapist would do if you're injured. They dig into an area that's trigger point spasmed and they usually just hold that pressure, not painfully, but they hold the pressure until that muscle just decides to unspasm. It's kind of cool. It's kind of like what we do with dry needling. There's a physical therapist down the street here that does dry needling, Mick out of Athletico, fantastic. You also have a physical therapist who used to use in Naperville, Mary Ratchford at Physical on Ogden, and she did A-stim, which included, it was essentially Chinese skin scraping, gua sha. And Chinese skin scraping breaks up muscle spasm, breaks up fibrosis, and you can use certain tools to dig into trigger points. Anyway, so muscle, when it's spasmed up and it's single, it's easy to define and easy to figure out. When there's too many of them, multiple trigger points, it's kind of sometimes hard to delineate. Is it a muscle? Where is it? Is it a joint? So in a nutshell, if we're dealing with muscle or joint or trying to figure it out, this is a muscle. The bicep is a muscle. The bicep, if there's pain right here at the belly, middle of the belly, that's probably just going to be muscle spasm. If there's pain towards the end here, and then that's where the muscle inserts into the joint. Usually the muscle goes over a joint and inserts into the neighboring bones. So that when you contract the muscle, it pulls the joint closed, flexes the joint. Anyway, sometimes you'll have tendon pain at the ends of your muscle. And then you'll have pain here at the joint. So you have joint pain just at the area that moves. You have tendon pain where the muscle ends. And you have muscle belly pain. So synovitis, tendinitis, myalgia. That's the way it usually goes. That's for a long bone, extremity. Sometimes it gets a little harder to figure out when you like a jaw or scalp or a back, but that's the bottom line. Now, if you can figure out whether it's muscle or joint, then you first start with muscle. Let's just say I'll tell you what I do for muscle. These are all rescues that I rely on for muscle. Muscle, first I would go with essential oils. Essential oils are fantastic. I'll put a link to my topical description, my tutorial on topicals. Essential oils are fantastic. I first learned about essential oils with an aromatherapist in Claremont, Florida, Jen Sense. And since 2005, I've moved back to Illinois. It's just easier for me to get essential oils on Amazon. I now rely on Panaway by Young Living, my favorite. So essential oils, they get through the skin. The theory is if it's pharmaceutical grade, it'll get through the skin, get through the blood, and then touch on the muscle that's spasmed. You've got to pass through a fascia too. Tough layer. That's the theory. I think it works, but what's proven is that you will definitely affect the skin. Not so sure about anything underneath that. If you apply your essential oil to dry skin, it might even get absorbed faster. But here's what I think. Here's what the proof shows. Essential oils get to the top layer of the skin. They eventually will filter out into the blood and cause you to absorb that plant. Essential oils come from plants. Plants that are distilled properly you get the oil out of the plant. Hopefully you'll get the active ingredient in the oil, and then you ingest that plant or you apply that plant, and then the healing properties of the plant are now with you. So essential oils or anything topical can help. The helichrysum, as I mentioned before, is great as an anti-inflammatory. There's also sandalwood and lavender. They're also great for relaxing. There's also capsaicin, which comes from peppers, and the Scoville units in capsaicin is high, but that's a different sensation. So the essential oils I just mentioned are mixed in with wintergreen or evaporatives, and when you put an evapораtive like wintergreen or menthol, camphor, it evaporates off your skin and it causes a cooling sensation. The cooling sensation will trick the brain into thinking, oh, I don't have any muscle spasm, I just have excessive amounts of cooling. So that does distract, and it does help you not to spasm up any further. Specifically when it comes to that capsaicin, which you'll find in DrRic over-the-counter cream, again from black peppers, the studies were on that, and that active ingredient decreased substance P in nerve cells underneath the skin, right on top of the muscle, and it made the brain forget about the muscle spasm that was underneath. It also made you, I've used it before, and it burns. So for me, I think it did help with me forgetting about the muscle spasm, because I was worried about me being on fire. I kept on checking it and getting blisters. It was so hot, I had to wash it off with soap and water. And that's Salonpas that I use. DrRic is just the cream. But anyway, so first thing, essential oils, work from the top in. Next would be turmeric. Turmeric, I think, is fantastic. Turmeric, I followed the studies of Janet Funk. She did turmeric and black pepper in a small collection of patients and found later on that their inflammation markers in the bloodstream went down. And that's turmeric and black pepper. That's not curcumin. Curcumin is the active ingredient in turmeric. It's turmeric. So when we talk about studies showing curcumin, I don't have a problem with that, but the whole plant is always better than the active ingredient, because there's other things we haven't studied in how the plant and its cells of the plant work. So I go turmeric and black pepper. I go that in turmeric and black pepper by, say, doctor's best, 3 times to 4 times a day. Really no side effects. Sometimes it'll dry. Turmeric is a astringent or a drying herb or spice. It can dry out your poop, so watch for constipation, and also watch out for if you have a bleeding disorder. Magnesium is fantastic. Most Americans are low in magnesium, especially those of you who are on a water pill. So when you're on a water pill, you can get cramps. And when you're dry, you get palpitations. When you're low in magnesium, cramps, palpitations, anxiety, insomnia, all of it happens. Constipation. So sometimes, not sometimes, if you have muscle spasm and you live in the Midwest and you're on a muscle relaxer, a water pill, I'd go magnesium. There's several types though. I love magnesium potassium aspartate. There's also magnesium glycinate. I do not like magnesium oxide or magnesium citrate. I think those are a waste of time. The absorption is poor. It essentially causes diarrhea. If you have a constipation problem, it's okay, but for muscle, I wouldn't use it. There's also magnesium L-threonate that gets more to the brain. So MagMind is what I usually suggest for my patients, mostly for people that have insomnia or anxiety. I use that at night. If you happen to have a low magnesium, I'd do that one too, kill 2 birds with 1 stone. But for me, magnesium L-threonate is not strong enough. I need it for palpitations and atrial fibrillation, which I admit to as well. So I got a lot of problems. IBS, AFib, fibromyalgia, but all of those are under control, and I'm not using a prescription medicine. So magnesium 2 to 3 times a day, recheck magnesium levels in about 3 months. But for the acute phase, you can also use magnesium spray. I think Life Flow makes a magnesium spray. It also gets in or penetrates through. It's mixed in with sea salt, I believe, so it stings a little bit. 3 to 4 times a day. Valerian is a great muscle relaxer. It's supposed to be used with hops for insomnia at night. I think Gaia brand Sound Sleep has valerian and hops in it. I think lemon balm as well. But valerian by itself can help to relax. So valerian 3 times a day, great muscle relaxer. And by the way, you can take all this stuff together even if I give you the prescription rescues. Everybody should have a prescription rescue, because if you're suffering, you can't move, can't eat, can't even poop, can't get to work, you should have your herbals or your prescriptions. For prescriptions, I'd use an anti-inflammatory like prednisone, or prescription anti-inflammatory, or an over-the-counter anti-inflammatory like Advil, meloxicam, Nambumetone, Aleve, Mobic, and then you get a muscle relaxer like Xanaflex, Scalaxin. There's sometimes Flexeril that everybody covers, but I think that causes a lot of side effects. Dry mouth, dizziness, blurred vision, tiredness. And then a rescue. Everybody has to have a rescue medicine. Can't fold this one out. Everybody has to have a rescue medicine. The rescue medicine is going to be narcotic. Tramadol is the easiest one. I can't give narcotics like Norco because I approve people for medical marijuana. I can't do both in the clinic. But Tramadol is okay. If you need Norco, you probably need to go to the emergency room or find another doctor. But so you can use all this stuff in addition to the prescriptions. So no harm, no interactions. Homeopathic medicines are good too because they have no interactions with anything, even chemotherapy medicines. Arnica montana is a great homeopathic. It's called a pellet at 30C, about 5 pellets, 3 to 5 times a day. Arnica montana. I didn't put that here. It's not a usual go-to of mine. Finally, CBD. Cannabidiol from hemp, or if you're lucky enough, you get medical marijuana with high doses of CBD, fantastic. Topical or oral, whatever it is, 3 times a day. If it's got THC in it and you're using medicinal marijuana, I wouldn't do it that often. I'd probably just use it at night because I'm not sure how tired you'll be and you might get into an accident. So that's for muscle. This would be for joint. For joint, I'd use glucosamine sulfate. I used to use glucosamine sulfate back in the 90s using the studies from Europe, from Germany in particular. This is when I found an orthopedic case or a sports medicine case that wasn't necessary to send them to orthopedics, but they needed to get into physical therapy, glucosamine sulfate. And usually 1,500 milligrams a day, whether it's with chondroitin sulfate or MSM or something called ASU, doesn't matter. I just try to make it on a regular basis twice a day. And if you need glucosamine sulfate chronically, sometimes because its effect lasts a while, you can go 3 months off, 3 months off. 3 months on, 3 months off, because the effects will last a little bit, and you can save money. And the one side effect of glucosamine sulfate is that it can cause an upset stomach just like Advil, so you want to cycle that on, off, if you need it all year round for arthritis. The next would be tart cherry juice. That's what Pam was using. Tart cherry juice, I learned that from David Heber. I met him at a conference for the Arizona Center for Integrative Medicine when it came to Chicago. He wrote the book Color of Your Diet. Good book. This was back in the 90s, I believe. And he gave the story that he gave his father tart cherry juice for his gout. And my dad has gout, had gout. And I gave it to him, and it worked. So I would give it to him from a white bottle. I don't remember who made the bottle. I buy it at Fruitful Yield, keep it in the fridge. Tastes like cherries, but you take about a shot worth about every couple of hours during the acute phase of the gout, and it calmed it down quick. Or if you can't get tart cherry juice, just get some organic cherries and start eating the cherries, and you'll hopefully see an improvement in range of motion of your joints. Now, whether glucosamine sulfate or tart cherry juice actually decreases inflammation, we're not sure. The studies were on range of motion and perception of pain, and it worked for that stuff. I think there are smaller studies out there that say, yeah, you can decrease this, that, and other thing. I don't know if I trust those studies. Bottom line, as long as there's not that many side effects, I think we're okay. So I guess tart cherry juice, you do have to worry about carbohydrate content if you're a diabetic. Finally, CBD. Again, CBD, but this time, because it's going into a joint which is deep, you'll have to do oral. Oral CBD 2 or 3 times a day, with or without THC if it's medical marijuana, versus hemp, leave it up to you. On a regular basis, that should be dosed properly. Now, you can have a couple other things like turmeric come over here too. I think turmeric helps muscle, but it also can get into the bloodstream and help joints that are inflamed, like people who have gout or rheumatoid arthritis or degenerative arthritis like back problems. Even a bulging disc, you can have this stuff useful because a bulging disc happens around a joint, but I would really rely on mostly this. Bulging disc is totally different. Joe, I just saw you for bulging disc the other day. I think it's important to check out my videos. I got a video on DrRic tutorial back school, DrRic tutorial piriformis sciatica, I believe. A couple different things. So check them out, Joe. Hopefully you're feeling better. And thanks for the shirt. So that's pretty much it. Always on top of all that, you should be using ice in case you're acute within a week, and then maybe heat later on. Ice helps decrease blood flow, and if you have a joint like an ACL on AstroTurf that we're worried about, you don't want that thing to blow up with blood. If you keep it iced up, at least even if you have a torn ACL, you won't accumulate that much blood, because what happens with joints that accumulate fluid, blood, or serosanguinous fluid fast, the fluid is used to immobilize. It's like the body cast. It makes the joint swell up. It makes you not move the joint, and no further damage. Body cast. But the problem is, if it's just if it's an ACL or a fracture, you don't want to move it. That's a good thing. If it's just a irritation, a tendonitis, then all that extra fluid that develops is going to, after the inflammation the trauma is done in a day or two, you'll have to deal with this fat joint. That fat joint also causes pain, and then either you have to wait for that to go down over the course of 2 or 3 weeks, or have to suck the fluid out with a big fat needle. And I don't mind doing it, it's easy, but if you can get the ice on every hour for about 5 to 10 minutes, don't burn your skin, but then don't put it on thick towels either. If you put it on thick towels, you're not going to feel the penetrating cold. You need the cryotherapy. See my video on DrRic tutorial cryotherapy. I think ice is great. Later on, heat might be helpful, but probably ask your provider first. In Chinese medicine, we don't use ice. Just because it stops the flow of energy, and well, I'm going to leave that for another tutorial. But so good question, Pam. And if any of you have any other remedies that you've relied on, manipulation, steroids through the skin, DMSO, put them down and maybe we can check them out. Otherwise, I'll see you in the next clinic.